Sagittal stability of the pelvis. There are two forces acting on the pelvic region. There is a downward force coming from the body weight pushing on the promontorium of the sacrum along the central gravity line. This descending force has a tendency to anteriorize the sacrum. On the other hand, there are two upward forces from the feet through the knees and the hips are placed anteriorly of the axis of rotation of the iliums. These upward forces give the iliums the tendency to posterior rotation. So the descending force and the ascending force have to be in a very good dynamic relationship. The balance between the descending and ascending force is maintained structurally by the shape of the sacrum and by the shape of the sacroiliac joints. So the more compression from above, the more compression we get in a lateral-medial direction towards the inferior part of the sacroiliac joints. This is called self-bracing. There are also some elastic structures that maintain the balance between the descending and ascending forces. These structures are capsules and ligaments. We find them on the superior-posterior side of the sacrum between the ilium and the sacrum. I'm talking about the sacroiliac posterior capsule and, on the other hand, the ligaments that we can find on the anterior lower part of the sacrum. These are the sacrospinous and sacrotuberous ligaments. Beside the structural and elastic elements that maintain the balance in the pelvis, there is also an active muscular balance. The most important muscles that keep this dynamic pelvic balance are the lower paravertebrals and an important part of the pelvic floor, the coccygeal muscle.